Good morning. It is 8:30 and a gray Thursday so far. Hope you're having a wonderful day so far. Adam Uglum here hosting the program, The Community Voice. It's time for a little political insight as you usually get on Tuesday and Thursday. Welcome to the program. Thanks for listening. The telephone number is 678-601-8255. Again, that is 678-601-TALK. If you don't have it on speed dial, like half my listeners do, I know this for a fact. Conducted a poll even. All right, so today's topic, I'm sure you're much awaiting. I mentioned earlier today that it wouldn't be contentious at all, and that's a flat-out lie, because I don't do anything on the program that isn't at least a little contentious. So the reason it's contentious is because we're talking about healthcare, something that's really contentious. Everybody thinks healthcare is a big deal. To some degree or the other, it is one of those sensitive things, because we all need healthcare at some point in our lives. And it's a topic that should certainly be discussed. My inspiration for the topic today, I'm sorting through my news papers here, because I'm kind of doing this off the cuff. Don't tell anybody. A news story from today about the GOP Doctors Caucus. If you were listening to the newscast before the program, you heard me with this story. And they're coming out all in support of this new House resolution, a bill on the House floor, called the Fiscal Responsibility and Retirement Security Act of 2011. Now, the left and right are both guilty of all these very crafty names. I mean, they might as well just call these rainbows and unicorns, most of the bills they come up with. It's kind of funny. I mean, really, just take a look at like the history of gun control bills, for example, and listen to the funny names and how they kind of evolve over time. It's very interesting. Anyway, District 11 Representative Phil Gingrey says the American people should not be on the hook when the program inevitably requires a taxpayer bailout to stay afloat. He says it is time for the administration to stop wasting time defending the numerous flaws in the Class Act and instead put that focus towards saving the Medicare program for the millions of seniors who depend on it each day. Now, that is one of the sharpest criticisms of the health care plan. Not what Phil Gingrey said, but that Medicare is being destroyed by the health care plan. One thing we do know for hard truth is that the bill explicitly calls for $500 billion of Medicare costs being passed on to the already struggling states to balance their budgets. States aren't very excited about it. It's probably why 27 states are suing the federal government on many different grounds, but both the constitutionality of the health care plan, and I'm sure they aren't very excited about having a much more difficult budget to balance either. So I'm taking a healthcare economics class this semester at UWG. And so far it's been kind of interesting. We actually watched Sicko in class, which I wasn't terribly excited about, to be perfectly honest. As you can imagine, it's a Michael Moore production. Sicko is a obviously very slanted left-wing production. While the movie is dishonest, it does raise valid points. I'm not going to be the first one. I certainly, you will not hear me praising the American system anytime soon in light of the fact that Michael Moore criticizes it so heavily. But CNN and many organizations have come out and just called Michael Moore intellectually dishonest. While he comes out with good points, CNN's Dr. Gupta said, hey, look, buddy, you can't take statistics from one survey for half your point and one from another survey for the other half of your point. It's just not right. You're taking the two extremes on purpose. It's not really honest. So there's a few things to kind of dissect from Sicko, and if you haven't seen the movie, if you think you can sit through it, go for it. It's a very riveting film. If you aren't a socialist afterwards, something is wrong with you. So what Michael Moore does is he travels to Canada, travels around the U.S. to find sob stories from uninsured Americans, Americans struggling to pay health care bills, and once he lays out how bad our system is, he travels to his relatives in Canada, he travels to Britain, he travels to France, and he even takes a dozen or so Americans to Cuba to get them free health care. But there's a lot of things he kind of leaves out also in the film as well. You know, he says France's healthcare system is free, but doesn't point out that 92% of the French population has private insurance to go along with their government care. Moore also frequently refers to the 47 million Americans without health insurance, but he also fails to point out that most of those people are uninsured only for brief periods, about 10.5 million or so. or that millions of them are already eligible for government programs. We'll get into those numbers later. I do have the facts and figures from the Census Bureau on that. Also, 9.7 million, this according to the Census Bureau, for 2010. 9.7 million in that 47 million are illegal immigrants. So we've already cut out a fifth of that 47 million just by leaving out the illegal immigrants. Moreover, Michael Moore implies that people without health insurance don't receive health care, which is false. In reality, as Michael Cannon, a researcher at the Cato Institute, most people do. Hospitals are legally obligated to provide care regardless of ability to pay, and while physicians do not face the same legal requirements, few are willing to deny treatment because a patient lacks insurance. Treatment for the uninsured may well mean financial hardship, but by and large, people do receive care. And that's one thing that Michael Moore does leave out, and he really kind of alludes to the hospitals turning people away thing, and that's, again, it's dishonest. Not to say that it doesn't happen. Just because it happens once or twice or a few thousand times over the course of a few decades doesn't mean that generally people without health insurance do receive care. Moore talks a lot about life expectancy, suggesting that people in Canada, Britain, France, and even Cuba live longer than Americans because of their healthcare systems. But most people agree that life expectancies are a pretty poor measure of healthcare because life expectancies are affected by far too many factors like violent crime. We have a high death rate here from guns. We have high crime, we have high death rate, we have high suicide compared to other countries. Poverty plays a role in this, obesity plays a role in this, culture, tobacco and drug use, a lot of other issues that are completely unrelated to a country's healthcare system also contribute to the life expectancy thing. So to say that because the French people live a year longer than we do and therefore they have a better healthcare system is just, I'm not even sure if it's dishonest, if it's just ignorant, to be perfectly honest. Americans in Utah live longer than Americans in New York City, despite having health care in the same country. It's very important to pay attention to these extraneous things. As a political science major, this is all I do, is look at, well, here's the data. The problem with the data is that the problem is explained by more than just A. No issues are ever black and white. There's always a gray that is the truth somewhere in the middle. If there is a problem, the problem is not caused by A, it's caused by 25% of A, 30% of B, 45% of C, and the rest of it by D. And that's what we need to dissect from any information that we see. Michael Moore in his video often downplays waiting lists in Canada, suggesting they are no more than inconveniences. In his video, he interviews apparently healthy Canadians who claim they have no problem getting care, yet nearly 800,000 Canadians are not so lucky. No less than the Canadian Supreme Court has said that many Canadians waiting for treatment suffer chronic pain and that patients sometimes die while waiting on the list. The Canadian Supreme Court ruled on this. Michael Moore shows happy English people in his video as well, who don't have to pay for their prescription drugs. At one point, he shows a gentleman who's an American without insurance, who travels to Britain to walk where the Beatles walked across that famous road. I'm not a pop culture person, but there's the famous Beatles album cover where they're walking across this crosswalk, and he wants to do a handstand and walk across this crosswalk. Well, he does a handstand, and he's not the most in-shape looking guy, so he tries to do a handstand across the crosswalk, which is dangerous on a street with moving vehicles anyway, the big dummy. So when he does his handstand, he throws his shoulder out. Well, he gets care, and I think the bill is extremely cheap in Britain, and he was worried that he didn't have insurance, but he went to the British hospital and got care. No problem. But Michael Moore didn't talk to any of the 850,000 Britons that are waiting for admission to the National Health Service hospitals. Every year, shortages force the National Health Service in Britain to cancel as many as 50,000 operations. Roughly 40% of cancer patients never get to see an oncology specialist. Delays in receiving treatment are often so long that nearly 20% of colon cancer cases, one of the most easily taken care of cancers, when it's considered treatable when it's first diagnosed, are incurable by the time treatment is finally offered. Moore also calls the French system free, as I mentioned earlier. But he ignores the 13.55% payroll tax, a 5.25% income tax, and additional taxes on tobacco, alcohol, pharmaceutical company revenues that fund the healthcare system. Despite the high taxes, the system is running an 11.6 billion euro deficit. The French system is not even free in terms of what patients pay. Its patients pay high co-payments and other out-of-pocket expenses as well. Physicians are able to bill patients for charges over and above what the government reimburses. And as I mentioned earlier, as a result, 92% of French citizens have private health insurance to complement the government system. Yet, there remain shortages of modern healthcare technology and a lack of access to the most advanced care. We'll be back after the break. I have a very scary interview I'd like to play for you. I think this has gone around a bit in email circles, and it was very surprising to me and a lot of my older listeners out there who are getting to the point where they may need some kind of neurosurgery, whether it be an aneurysm, a stroke, things like that, or if you have relatives who have had aneurysms, strokes, things like that, may be very worried about this interview. We'll be right back after this break. Alrighty, lots to finish. This is a big, complicated topic, so I'm going to go straight to this interview from the Mark Levin Show. I'm just going to tell you, if you're a senior, and I know I've got lots of older listeners that listen to the program, this is going to bother you a lot. I don't want to hype it up too much, but I'm just saying.
All right, let's see. Jeff, Chicago, Illinois. I know you're not listening on WLS because it's tape delayed there, but WLS Country, how are you listening? Or did you just pick up the phone?
Can you hear me?
I can hear you, sir.
Oh, okay. Sorry. Yeah, I'm driving, actually, from Chicago to Detroit. But yes, I heard you talking earlier about the government not knowing how to make pencils, and then you talked about brain surgeons, and I happen to be a brain surgeon. So I found your topic quite interesting, and actually just returned from Washington, D.C., where we were reading over what the Obama health care plan would be for advanced neurosurgery for patients over 70, which we all found quite disturbing because as our population gets older, the majority of our patients are getting over 70 that require stroke therapy or aneurysm therapy. And basically what the document stated was if you're over 70 and you come into an emergency room and you're on government-supported care, that you get comfort care. And
wait a minute. What document and where did you hear? What's the source for this?
This is Obama's new health care plan for advanced neurosurgical care.
And who issued this? HHS?
Yes. And basically, they don't call them patients, they call them units. And they call it ethics panels, or ethics committees would get together and meet and decide where the money would go for hospitals, and basically for patients over 70 years of age, that advanced neurosurgical care was not generally indicated.
So it's generally going to be denied?
Yes, absolutely.
All right, let me ask you this. Is this published? Go ahead.
If someone comes in at 70 years of age with a bleed in their brain, I can promise you I'm not going to get a bunch of administrators together on an ethics panel at 2 in the morning to decide that I'm okay to do surgery.
Let me ask you this. Is this published somewhere where the general public, in other words, a pedestrian like me, can get a hold of it? No?
Not yet.
So this was discussed just with your community of neurosurgeons?
Yes, exactly. The AANS and CNS, the American Association of Neurosurgeons, and the Congress of Neurosurgeons, because everybody knows cuts are coming in medicine and reimbursement, and we're the most expensive out of all the fields in medicine, and we're the smallest field. But at 2, 3, 4 in the morning, we're the ones that are in the operating room, and we have to wait for an ethics panel to convene, which are not made of physicians, which are made of administrators, to decide whether a patient should receive our care.
So Sarah Palin was right. We're going to have these death panels, aren't we?
Oh, absolutely. I'm German by heritage, and I've read the Rise and Fall of the Third Reich, and basically if they don't call them patients, they call them units. And if you're a unit above a certain age, you get comfort care instead of advanced neurosurgical intervention.
Now, this you went to a seminar in Washington, D.C.?
Yeah, where a few of my former partners, 2 of them have gone to work for, one is running the VA system, and one is head of the Congress of Neurosurgeons out of D.C.
And this information is based, you're certain, on representations and information provided by HHS and other government officials?
Yep.
And when will the rest of us become aware of it? After the election?
Probably. I mean, if, there's so many things that the government keeps under control that are used in surgery called HUD devices, or humanitarian use devices, that we're allowed to use now because they haven't undergone full FDA approval. And they're just used in surgery because people know it's the right thing to do, but the government can step in at any time, like they did 2 months ago with the device, and said, this device hasn't met what we want, and there's no exact criteria, and then they can take it away from us.
And the people telling you what to do, they don't know how to make a pencil, do they?
Exactly. That's what I'm saying. And, we always joke around, it's not brain surgery, but, I did 9 years after medical school, I've been in training 10 years, and now I have people that don't know a thing about what I'm doing telling me when I can and can't operate.
All right, Jeff, please keep in touch with us. Well, yeah, I have to go, but this was a very, very crucial call. All right, my friend? Thank you. We'll be right back.
So there you have it. That was from the Mark Levin show, I think sometime a week ago or two, and something that has not gotten much coverage. Now, I know it's just an interview, phone call, and a radio program, but you'd think some people would be investigating into this big time. It doesn't sound like this is extremely confidential information, whether it's official, public, or not, whatever the case may be. I think that should bother a lot of people. We'll take one quick break and be right back, and we'll get back into this whole 46 million uninsured Americans thing and what it really boils down to. We'll pick apart the data right here for you on News Talk 1330 when I come back from the break. All right, and we are back. Lots to cover again on the program. One of the last things I want to get through here is this whole 46 million uninsured Americans thing. For starters, the statistic comes from the Census Bureau, arguably an objective resource when it comes to data like this. It comes from the annual report, which most recently pegged that number of uninsured Americans at 46 million for 2007. But the problem lies in the way that statistic is commonly cited and understood. The headline, for example, 46 million uninsured Americans, as the New York Times, for example, reports in a recent story on healthcare, is often echoed throughout the media, left, right, Fox, CNN, doesn't matter. But a quick look inside that report tells us that nearly 10 million of those people who are uninsured are not citizens of the United States. But this doesn't change the fact, as a matter of accuracy, that, the left may think we should cover them. But it does tell us that the census data says that 36 million Americans are uninsured, and this doesn't fully convey the problematic nature either. Because even as the authors of the Census Bureau report themselves acknowledge, quote, health insurance coverage is likely to be underreported in the current population survey from which the health insurance data is derived. The reason is that respondents are asked in February through April about their health coverage status in the previous calendar year. Some may answer the question as intended, but others may cite their current insurance status, and others may say they were without insurance even if they only spent a portion of the year without coverage. Quote from the report, the estimate of the number of people without health insurance, according to the report, more closely approximates the number of people who are uninsured just at a specific point in time in that year. In reality, a person who goes without coverage for a few months while between jobs is a completely different boat from somebody who is permanently without health insurance. But the broad citation of the headline figure would have you believe there are literally 46 million people who never ever have coverage. Subtract 10 million for illegal immigrants. And how many people actually spend the whole year without health insurance? Well, this is something that's awfully hard to figure out. But in 2003, the Congressional Budget Office did take a stab at answering that question. and looked at two studies, one from 1998 that conducted interviews multiple times over the course of the survey period, and one study pegged that number of people who are uninsured for the entire year at 31 million, while another put it lower at 21 million. In either case, the number was significantly lower than it was in 1998's current population survey, which found 43.9 million uninsured. Another problem with the 46 million figure is that many of those who are identified as uninsured are actually eligible for existing government programs but simply never bothered to enroll. In 2003, a Blue Cross Blue Shield Association study estimated that about 14 million people of the uninsured, of this nebulous 36 million, 14 million of these uninsured were eligible for Medicaid and SHIP. These people would be signed up for government insurance if they ever made it to the emergency room. In addition, some of the 36 million, if we're subtracting the illegal immigrants, could theoretically afford health coverage but choose not to purchase any. In 2007, 17.6 million of the uninsured, nearly half, had annual incomes of more than $50,000, and 9.1 million, bringing the total to 28 million people, had incomes of more than $75,000. So 28 million people of those who are uninsured make incomes between $50,000 or more than $75,000. In fact, as one author notes in the Top 10 Myths of American Healthcare, a Citizen's Guide, those making more than $75,000 per year are part of the fastest growing segment of the uninsured population. Persons who make more than double the median income are the fastest growing segment of the uninsured population. For whatever reason, this is just point of fact according to the Census Bureau and this report. The census figures also show that 18.3 million of those who are uninsured were under 34. Some in this age group, likely a lot of them, may have simply determined that they are young and healthy and thus can do without coverage. When all of the factors are put together, you can pretty much determine that somewhere around 8 or 10 million Americans are actually without coverage for the long haul, because they are too poor to purchase health care, but earn too much to qualify for government assistance. Even being without insurance doesn't mean they won't have access to care either, because again, federal law forbids hospitals from denying treatment to patients who show up at the emergency rooms. So people will get care. They may be in debt for 6 years or 10 years. Healthcare bills are 1/3 of the bankruptcies in the United States. If I recall, I've heard that number somewhere. And that's a problem. I'm not saying that's a good thing. I'm not saying the American system is great, but the numbers do deserve being picked apart. So while people use this 46 million people statistic to boost their cause, the media and those who use it are the ones who are rigging the game in their favor. Because while they'll tell you that 46 million, which is 11% of the population, 10 million of them are, again, illegal immigrants. So we immediately cut that by a quarter. So now we only have about 8% of the population who's uninsured. 25 million of them could probably afford it, considering they make $50,000 to $75,000 or more per year. So why are they included in the statistics? They can afford it and just choose not to purchase it. I mean, we're really talking about 2 or 3% maybe of the population who really just cannot get health insurance. So the number is just highly inflated. Now, those people do need to get health insurance. How we do that is entirely up to your political transgressions. I'm just saying that the numbers out there that you hear all the time need to be looked at. You need to know this kind of information because left or right, they're going to give you the number that promotes their cause. The truth is usually somewhere in the middle. And in this case, it's largely on the side of the status quo, because under the status quo, most people get care and most people have insurance. More than 95% of the population either has health care or can afford it and don't have it. It's a choice. What was the number? 10 million people of the uninsured are under the age of 34, people who largely just don't need health insurance. And as a 24-year-old male, I've shopped around for health insurance too. You can get a cheap health insurance plan that will cover expensive things. A catastrophic health insurance plan is about $50 a month. Health insurance for young people is cheap. There's really no excuse not to have it as a young person. But even still, 10 or so million people are just young folks who don't think they need health care. Now, that probably creates problems because their appendix might burst when they're 29 and they think they're healthy, and that obviously causes a problem. I can't say it enough that 25 million of those 37 million who are uninsured and American citizens, 2/3 make more than $50,000 a year. 10 million of those 25 earn more than $75,000 a year. So again, take it all with a grain of salt is all I'm saying here. Because the 46 million people number is just not true. It's dishonest, we'll call it. It's like Michael Moore. Hope you enjoyed the program. I'll catch you folks bright and early tomorrow morning at 6 a.m. Hard to believe Friday's already almost here. It's Thursday, February 2nd. What a strange winter we've had. It's about warm outside. I had to take off my long sleeve shirt. It's warm. Don't forget the website, libertariat.wordpress.com. You can also email me at libertariats@gmail.com for comments, suggestions for future show topics, criticisms, whatever it is. Libertariats@gmail, libertariats.wordpress.com.